Good morning. My name is Carol, and I am a registered nurse in a neonatal intensive care unit at a community hospital in southern Arizona. I have an interest in promoting policy regarding the opioid epidemic crisis. I have an interest as an Arizona resident, as a nurse that cares for patients born addicted to opiates, and I've been affected by family members' deaths due to opioid overdose. As a tax-paying citizen of Arizona, I am financially impacted as well. Prescription opioid misuse and abuse is a public health problem that can be addressed with policy. Opioid abuse is the cause of one of the deadliest and preventable epidemics currently affecting public health. The number of deaths from opioid prescriptions increases as the number of prescriptions has steadily increases throughout the United States. For the purpose of this discussion, we'll be addressing the problem within the state of Arizona. The state has experienced an increase in deaths at a rate of 74% from 2014 to 2018. This result has moved Arizona into the 15th highest state in the country for deaths from opioid overdose. The Arizona Department of Health Services reports an increase of over 100% in the cost of opioid encounters, resulting in a significant impact on the healthcare system, with costs reaching $341 million during 2016 alone. We are experiencing an opioid epidemic in Arizona that must be addressed with urgency and an effective policy. My proposed policy to address this issue would be the current Arizona policy with the inclusion of regulating and requiring prescribers to obtain continued education in the topics of opioids. Currently, Arizona has a policy that Governor Doug Ducey signed into effect in January of 2018 called the Opioid Epidemic Act. This law addresses and targets access to treatment, access to naloxone, addiction prevention. It addresses pill mills, responsible prescription limits, doctor shopping, the implementation of Good Samaritan Law, and the Angel Initiative. Provisions of the Opioid Act, they're expanding access to treatment, treatment for those that are abusing opioids, and we have also addressed youth prevention of opioid misuse as well. Law enforcement, emergency medical personnel, and those at risk of overdose will gain access to naloxone, bigger access to naloxone than ever before. The opioid state lets us know that 86% of patients that survive opioid overdose receive naloxone before arriving at the hospital, so we've granted greater access to those in need. Individuals that are prescribing and dispensing opioids are going to be held more accountable for their practice. The Act regulates and prohibits those who can prescribe opioids, and it places a limitation on initial prescriptions. In January of 2019, all those prescriptions will be required to be electronic. The oversight of pill mills will be eliminated. The oversight will become stronger. There'll be cessation of dispensing opioids on site when a prescription is written. The Good Samaritan provision is important in our state. It encourages people to use emergency services, call 911, go to the ER for potential opioid overdose without the risk of prosecution. And the Angel Initiative encourages those who are struggling with addiction to seek out treatment without the fear of prosecution. The policy that I'm proposing maintains the Opioid Epidemic Act, but it includes the recommendation, the regulation, the requirement of prescribers to obtain 3 hours annually of opioid-related continued education. Arizona physicians are already required to complete 40 hours of continued education every 2 years as mandated by the Arizona Medical Board. This policy would force prescribers to adjust their educational topics, but should not cost any more money than what is already spent at this time. The medical board already monitors the continued education hours and would continue to do so, ensuring the topic of pain management was covered. The reason why this policy was chosen over other alternatives because it was a more comprehensive policy than what is current, and it would get more to the root of the problem, which is often inappropriate prescribing of opioids. I had another alternative that was a referral for physical therapy, but ultimately, if prescribers and providers are not understanding appropriate pain management, a referral to physical therapy would just become a checkoff on a box of a list of things to do. The money and time spent by the state to implement the other alternative would be more significant and less effective ultimately than the policy to include continued education. As far as an economic impact, the opioid epidemic is one of the biggest issues facing our economy today. Politicians often talk about this crisis in the fact of moral terms. We're talking about how it negatively infects families and communities, which is an important conversation to be had. But it's also important that we talk about the negative impact on our economy. There are fewer working age men that are participating in the labor force, many who have been found to be taking prescription medications. Research by Princeton economists, they've indicated that there is a link between the two. We are estimating in the year 2011, the associated costs, healthcare costs, criminal justice costs, and lost earnings and employment reached $55.7 billion across our country. Just 2 years later, in 2013, we saw it reach $78.5 billion. The socioeconomic burden is broad. And then we cannot forget the economic value of a loss of a life. Insurance companies often place value of a human life at $5 million. Arizona Department of Health Services updates in real time lives lost, babies born addicted to opiates on their website. If we look at the Arizona deaths in the first 4 months of 2018, there's been 1,133 mortalities. If you're looking at $5 million a life, that's cost our state $5.6 billion in the first 4 months of this year. If you look at the 687 babies born addicted to opiates in Arizona in the first 4 months of this year, their average hospital stay is almost $17,000. That's cost our state $11.6 million in the first 4 months of 2018 alone. Where are we now? We try to do things to prevent deaths from cars, deaths from cigarettes. What are we going to do to prevent these deaths from opiates? How are we going to measure success? We're going to see a decrease in prescriptions written, a decrease in the number of opioid-related deaths, an increase in physicians reporting confidence in pain management. There will be an increase in continued educations in opioid or pain-related topics. I am asking for your help in supporting the continued education policy. Arizona is taking large steps, big, giant, beautiful leaps towards the prevention and treatment of opioid misuse and abuse. We've had meaningful progress. We have a detailed action plan that was signed into law in January of this year, 2018. We're promoting awareness. We're promoting safe prescribing, improved access to addiction treatment, improved availability of life-saving drugs, removing the fear of prosecution through the Good Samaritan and Angel Initiative law. We've reached a crisis level. It is imperative that we address this crisis. It is imperative that we speak out for the tiny voices who cannot speak and the voices that can no longer be heard. I ask for your help in supporting this policy. Thank you.